My name is Cara Eisinger. I am a broker and co-owner of Group Plans Inc., which is my family's business here in Anthem, Arizona. I'm an independent local licensed insurance agent. I do not work for Medicare. And today I am mainly here to provide an educational presentation about Medicare 101, getting ready for Medicare. And I do see that most of you are new to Medicare, but also that one of you are not. So this will hopefully be a good refresher course for you. So let's go ahead and get started here. On today's agenda for the presentation, we are going to talk about learning the basics of Medicare, Medicare supplement plans, also known as Medigap, health savings account, HSAs, what happens to those after you turn 65, late enrollment penalties, and programs that help with the limited income and resources for people, and income-related monthly adjustment amounts, which we call IRMA. And sorry, I had to thumbnail something on my side here. So what is Medicare? Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. Who is eligible? People over 65, certain people under 65 with disabilities, and people of any age with end-stage renal disease or ALS, also known as Lou Gehrig's disease. Medicare is individual insurance, which may be different for you if you're used to getting coverage for you or your family through an employer plan. Each person must meet Medicare eligibility requirements as an individual, and each person is covered as an individual. So for example, one spouse may turn 65 and enroll in Medicare while the other spouse is not yet eligible. Also, Medicare is not Medicaid. Medicaid is health insurance for people with limited income and resources, but I get asked a lot of the time, can you have both Medicare and Medicaid at the same time? Yes, you absolutely can. We call this dual eligibility in my industry. So we're already going to jump into pop quiz time. So pop quiz, what year was the federal Medicare program signed into law? 1900, 1965, 1980, or 2003? Looks like most of you are historians of Medicare. Great. Okay, so correct. Medicare, the federal Medicare program was signed into law in 1965 by Congress and President Lyndon B. Johnson. Okay. Oh, there we go. So how is Medicare funded? Medicare is paid for through two trust fund accounts held by the U.S. Treasury. One fund is called the Hospital Insurance Trust Fund. Medicare is funded in part by federal payroll taxes paid by employees and employers. The tax is labeled FICA on your pay stubs. The other fund is called the Supplementary Medical Insurance Trust Fund. Medicare is also funded in part by premiums paid by people already enrolled in Medicare Part B and Medicare Drug Coverage Part D. And so before we dive into the 4 parts of Medicare, I have another fun pop quiz, and then I promise we won't do one for a little bit. Use your best guesstimate. How many people do you think are currently enrolled in Medicare approximately? Okay, fantastic. Looks like most of you got that right. 58.6 million is the correct answer, at least according to a recent report by the Kaiser Family Foundation. So back to what are the four parts of Medicare? We have Part A, hospital insurance, Part B, medical insurance, Part C, Medicare Advantage, and Part D, drug coverage. Part A is referred to as hospital or inpatient insurance. Part A has a premium, but few people pay it. Remember the FICA, payroll tax rule. If you or your spouse paid FICA for 10 or more years total, you get premium-free Part A. If you are not eligible for premium-free Part A, but are eligible to enroll in Medicare, these are the premiums for 2022 and 2023 based on your work credits with Social Security. Most Medicare Part A coverage services are listed here. One important thing you may notice missing from this list is doctor services. That's because doctor services are covered under Part B, as in boy, even when you're in the hospital. I also included what Part A does not cover, such as private duty nursing. If you have an inpatient hospital room with no television and you request one, you may have to pay for that. Okay. Part A cost share is based on a benefit period. A benefit period begins the day you are admitted to the hospital and ends after you've been out for 60 days in a row. The deductible and copays reset after each benefit period. So for example, you go into the hospital, you're in there for a month, you get out, more than 60 days has passed, you go back in the hospital, you start a brand new benefit period and a brand new deductible. The lifetime reserve days are extra covered hospital days you can use if you are in the hospital longer than 90 days during your benefit period. So Medicare Part A gives you 60 lifetime reserve days, and each reserve day can only be used once, but they can be applied to different benefit periods. And the lifetime reserve days, again, they kick in after you're in there consecutively for 90 days. Part A covers you at any hospital in the country that accepts Medicare. And lastly, you cannot be denied Part A coverage regardless of your health or financial status. Now let's look at Part B, medical insurance. Part B does have a monthly premium. The monthly premium can adjust based on income, which we'll look at later during this presentation. But the base premium for Part B in 2022 is $170.10 per month. And next year, it's actually going down a little bit, $164.90 per month. The main covered services under Part B are listed here, including doctor visits, tests or exams your doctor might order, and other outpatient services. Also, as we just discussed, Part B does cover doctor services when you're in the hospital as well. What's not covered under Part B? Well, Medicare does not cover most prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision, hearing care, as well as any corrective treatments such as glasses or hearing aids. Long-term care, such as a nursing home, is also not covered by Medicare. Part B does not have a benefit period, but instead a calendar year deductible. This year, the deductible is $233, and next year it will be $226. After you meet your deductible for Part B covered services, you will pay 20% of the Medicare approved costs. There is no cap on that 20%, no out-of-pocket maximum. Same as Part A, you can't be denied Part B coverage regardless of your health or financial status, and you may see any provider in the country that accepts Medicare. So real quick, before we go on to Part C, Part A and B is what we refer to as original Medicare. Now under Part C is referred to as Medicare Advantage. Medicare Advantage is an alternative to original Medicare and offers another way to get your Medicare Part A and B benefits plus more. You still have Medicare. Medicare just contracts with private insurance company to administer your Part A and Part B benefits. Therefore, you must be enrolled in both Part A and Part B to be eligible for a Medicare Advantage plan. You must also live in the plan's service area. By law, Medicare Advantage plans must provide all the benefits that original Medicare does. Most Medicare Advantage plans include other benefits like prescription drugs, routine dental and vision. All of your benefits are covered under one plan. There are different types of Medicare Advantage plans. Most are coordinated care plans where care is delivered through a provider network. You may get care outside of the network, but you may pay more or even the full cost. Most coordinated plans are HMO or PPO. HMO stands for Health Maintenance Organization. PPO stands for Preferred Provider Organization. PPO plans generally offer more coverage for out-of-network than HMO plans do. I also have listed here POS, which stands for Point of Service. These types of plans are sort of a hybrid, with network care covered like an HMO and care outside the network covered for certain services. Special needs plans, that's what SNP stands for. These plans are specifically designed for people with certain healthcare needs, individuals who are eligible for Medicare and Medicaid, people who live in nursing homes or have certain chronic conditions such as diabetes. PFFS stands for Private Fee-for-Service plans. These plans typically offer more flexibility in choosing providers than other types of plans do. And in general, with a private fee-for-service plan, you can get care from any Medicare-approved provider who accepts the plan's terms and conditions. Lastly, MSA stands for Medicare Savings Account plans. These plans combine high deductible health plan with a medical savings account, and they generally offer more choice with more financial risk. Okay. You cannot be denied coverage for a Medicare Advantage plan based on current financial or health status, including pre-existing conditions. Medicare Advantage plan costs. You will continue to pay your Part B premium directly to Medicare while enrolled in a Medicare Advantage plan. And plan premiums, deductibles, coinsurance, out-of-pocket maximums, all of these things are based on the specific plan and service area. Now let's move on to the fourth part of Medicare, Part D prescription drug coverage. An easy way to think about this is the D for drugs. Remember, drugs are not covered by original Medicare except in select circumstances. You can get drug coverage in two ways, through a separate standalone Part D plan or through a Medicare Advantage plan, as we just discussed. Standalone Part D plans can work with original Medicare, Medicare supplement plans, and select Medicare Advantage plans like private fee-for-service plans and Medicare savings account plans without drug coverage. You could get a standalone drug plan with those. All the other Medicare Advantage plans, though, the HMO, PPO, special needs plans, those you cannot get a separate standalone Part D plan. And like Medicare Advantage, Part D plans are offered by private insurance companies. Plans provide coverage for retail and or mail order pharmacy medications. They also cover all commercially available vaccines like the shingles shot that aren't covered under Part B, as in boy. However, the Inflation Reduction Act will eliminate the cost sharing for adult vaccines covered under Medicare Part D beginning in 2023. Plans provide excuse me, similar to Medicare Advantage, there are no pre-existing conditions and you cannot be denied coverage for a Part D plan if you're eligible. You must be enrolled in Medicare Part A, Part B, or both to get a Part D drug plan. It's important to enroll when you're first eligible or when credible drug coverage ends. You could be charged a premium penalty if you are late enrolling in Part D unless you qualify for special enrollment, and there will be more to come on that part. Each Part D plan or Medicare Advantage plan that includes drug coverage creates a list of specific drugs that it will cover. The list is called a formulary. Each plan has its own list of covered drugs, but every plan must cover a range of both generic and brand name drugs that are generally needed by people on Medicare. Many Part D plans group the drugs that they cover into levels or tiers. Drugs in different tiers have different costs. So for example, you may pay more if you have a higher copay or coinsurance for a tier 5 drug versus a lower tier 2 drug. Also, some plans may have a deductible for some tiers and not for others. Lastly, you may be required to use a specific pharmacy network, which can vary with each plan and can change every year. Also, the formularies can change every year as well. When choosing a plan, it's very important to make sure that the drugs you take are on the plan's list of covered drugs and to understand the costs, which can vary. Every Part D prescription drug plan goes through 4 different stages, coverage stages with Medicare. The stage you're in determines the amount you pay when you fill a prescription. Each stage has a dollar limit set by Medicare that marks when you exit that stage and enter the next. The limits that will be shown here can change also from year to year. You will begin in the deductible stage if your plan has a deductible where you would pay the full cost for your drugs. Or some people start in the initial coverage stage where you usually pay a copay or coinsurance percentage. If your drug costs reach the limit for the initial coverage stage, and that's not what you pay, but the actual retail cost or what the plan pays for your meds, if those costs reach the limit, which is $4,430 in 2022, $4,660 next year, then you enter what's called the coverage gap or the donut hole. In the donut hole, you pay a greater share of the cost for your medications, 25% for the cost of your generics and 25% for the brand name drugs. So not everybody enters the coverage gap, but if you do and your drug costs reach the catastrophic limit, then you enter stage 4, catastrophic coverage, and you pay reduced copays or coinsurance for the rest of the year. This cycle restarts every January 1st. And then also, I just wanted to point out that the recently passed Inflation Reduction Act is amending the design of the Part D, as in drug benefit. And in 2024, the law eliminates the 5% coinsurance requirement above the catastrophic coverage threshold, capping out-of-pocket costs at $3,250 that year. So right now, with these drug stages, there is no maximum out-of-pocket for somebody with Part D coverage. Okay, great. So now we're going to go to our next pop quiz. Kind of a little refresher, see if you're awake. Which part of Medicare costs, which part of Medicare covers doctor visits?
We're not as quick on that one.
Oh, here they come in. 100% correct. What great students. Yes, Part B is the part of Medicare that covers doctor visits. Next question, which part of Medicare covers maintenance medications you would pick up from a pharmacy or have mailed to you? Part D, also 100%. Excellent. Great job, guys. Okay. So now we come to Medicare supplement insurance, or what's often called Medigap. Medicare supplement plans, which are also offered by private insurance companies, are different from the plans we've discussed so far. As the name says, they supplement Medicare. So they are not Medicare plans in and of themselves. Medicare supplement plans help pay some of the out-of-pocket costs that come with Medicare, like deductibles and coinsurance. They can also be used, only be used with original Medicare, Parts A and B, not with Medicare Advantage. I'll say that again. So a Medicare supplement plan can only be used with original Medicare, not with the Medicare Advantage plan. They're separate. Plans are purchased from private insurance companies, and the benefits are standardized by the federal government. There are 10 plans labeled with letters such as A, B, C. Every plan of the same letter provides the same benefits no matter what insurance company offers it. I do have to mention that Massachusetts, Minnesota, Wisconsin are exceptions to this rule, as these states standardize their plans differently. It's also important to note that Plan C and Plan F are only available to individuals who are eligible for Part A or turned 65 before January 1st, 2020. Some plan providers may offer value-added services for free or on a discounted basis, but they are not part of the Medigap plan directly. Some other important facts to know: you must be enrolled in both Medicare Part A and B of original Medicare to be eligible for a Medicare supplement insurance plan. And you must choose a plan that's offered in your state. There is a set enrollment period when you can't be denied coverage or charged more based on your health history to get a Medicare supplement plan. That's what's called a Medigap open enrollment period. It is 6 months long, and it starts on your 65th birthday month or your Part B effective month, whichever comes later. This table may help you see the different standardized plans and how they help with the level of coverage. So 100% in the chart means 100% covered. You'll see that these plans help pay for coverage already provided by original Medicare and may extend it in some cases, as with extra hospital days. So remember those lifetime reserve days I mentioned? You can see that the Medicare supplement plans add an additional 365 lifetime reserve days to your Part A coverage. Okay. Some programs may cover the Part B deductible costs, but only for those individuals who were eligible for Part A or turned 65 before January 1st, 2020. So remember on my last slide, that would be Plan C and Plan F that cover the Part B deductible. And sorry, on my chart, it's under D that it says 100%. So that's a typo. I'm very sorry about that. Except for foreign travel emergency coverage, Medigap plans don't fill in for what original Medicare doesn't cover, such as prescription drugs, routine dental, routine vision care. So in general, the broader the coverage in the standardized plan, the higher the premium. That's how it normally works. But the premium can vary even for the same coverage. Premiums vary based on different states, different insurance companies. And then lastly, Medicare supplement coverage is nationwide and goes with you wherever original Medicare does. Now we're going to see how it all ties together. How Medicare supplement insurance, Part D or Part C Medicare Advantage will fit maybe into your portfolio. You have two options for more coverage. Your first option is to have original Medicare as your primary insurance, which is your red, white, and blue card you'll get, and to add a Medicare supplement insurance plan and or a Part D prescription drug plan to original Medicare. With option one, you would have access to any doctor or hospital in the country that takes Medicare, and you do not need a referral to see specialists in most cases. Medicare supplement insurance will help pay some of the out-of-pocket costs not paid by Medicare Part A and B. And then the Part D prescription drug plan will cover prescription drugs. The second option is Medicare Advantage. So just to put a reminder, you can't have both. You can't have a supplement and an Advantage plan. So this would be, we'll call it option 2. Most Medicare Advantage plans include drug coverage and additional benefits such as dental and vision. In most cases, you'll need to use doctors who are in the plan's network. You may need a referral to see a specialist depending on the plan in the network. And Medicare Advantage plans may have lower out-of-pocket costs than original Medicare, such as an out-of-pocket limit for A and B services, or you may know it as an out-of-pocket maximum for the calendar year. So, wait, what? Another pop quiz. Great. Can you enroll in both a Medicare supplement plan and a Medicare Advantage plan at the same time? And I reiterate this because it's so important to know. And everybody on this webinar, 100%, I like to see that. It's very important to know the differences. Great. Right. So now that you know all about A, B, C, D, and Medicare supplement, let's go back to original Medicare A and B. When should you enroll for those parts? Most people first enroll in Medicare during their initial enrollment period, or what we call IEP. Your IEP is 7 months long. It includes your 65th birthday month, plus the 3 months before and the 3 months after. If your birthday month is on the first of the month, then your enrollment period actually begins 1 month earlier and ends 1 month earlier. If you qualify for Medicare due to a disability, then your initial enrollment period includes your 25th month of receiving disability benefits. The 3 months before your 25th disability month is when it begins and ends 3 months after. During your initial enrollment period, you can also enroll in additional coverage such as Medicare Advantage, prescription drug plan, or Medicare supplement insurance, but keep in mind you have to have your A and B to get an Advantage plan or a supplement. You have to have A or B to get a drug plan. To get any of these 3 types of plans, you'll have to enroll with the private insurance company offering the plan. Not everybody signs up for Medicare when they are first eligible. If you're working past 65, you may refuse or delay Part B enrollment and just take premium-free Part A, or not even that. This may be a good idea for people who have employer or other credible coverage. Some employers require you to take full benefits, though, Part A and B at age 65. And this can vary based on a number of factors, but a lot of the times it is based on the size of the employer. And ensure if you do decide to delay that doing so won't mean paying a late enrollment penalty later on. And we're going to talk about penalties later in the webinar, but some other points to consider when considering delaying enrollment into Medicare will be if I'm the employee, how will my spouse and dependents be affected? If my spouse is the employee, will I still be able to be covered as a dependent once eligible for Medicare? Another popular question I'm asked is, what happens to my health savings account after age 65? So first, let's quickly go over what an HSA is. It's an account for individuals or families with a high deductible health plan. The funds contributed to an HSA are not taxed when taken out for qualified medical expenses. If you enroll in Medicare Part A and or Part B, you can no longer contribute pre-tax dollars to your health savings account. However, you may continue to withdraw money from your HSA after you enroll in Medicare to help pay for medical expenses. And some of the qualified medical expenses under Medicare would be deductibles, premiums, but not Medicare supplement premiums. So it would be your Part B premium, your Part D is in drug premium, also co-payments and co-insurance that may be out of pocket for you. So remember, whether delaying Part A will depend on your circumstances, such as employer size, and also whether you're receiving Social Security retirement benefits. And that's because if you're receiving Social Security retirement benefits, you're automatically going to be enrolled in Medicare. If you decide to delay enrolling in Medicare, specifically Part A, make sure to stop contributing to your HSA at least 6 months before you plan to enroll in Part A and or B. If you do not stop HSA contributions at least 6 months before Medicare enrollment, you may incur a tax penalty. And that is because Medicare will issue a retroactive effective date for your Part A coverage. They go back 6 months if you're entitled to premium-free Part A. And I would like to note that I'm only an insurance professional, not a tax professional. So please consult your tax professional for HSA counseling. We talked about working past 65 and how you may be able to delay coverage. If you qualify, Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You will have 8 months to enroll in Part B and Part A if you haven't already. You may also enroll in a Medicare Advantage plan or Part B prescription drug plan within the first 2 months after losing your employer coverage. So it's important to pay attention to these timings because the Part B special enrollment period is 8 months. But if you lose your drug coverage through your employer plan, you have 2 months to get a plan, a Part D plan or a Medicare Advantage plan to get be out of the penalty time frame. To be eligible for this special enrollment period, you must have been continuously covered by insurance from current work or by Medicare Part B since becoming eligible for Medicare. Sometimes people go on Part B and then they drop it to go on employer coverage and then go back. So that's what that's referencing. One more thing, make sure your employer provides you with a proof of credible drug coverage. This means your drug coverage is at least as good as Medicare Part D provides. If your drug coverage does not meet this standard, you could be penalized. And then lastly, don't forget that your 6-month Medicare supplement open enrollment period will be triggered once you are enrolled in Part B, as in boy, through this special enrollment. If you miss your initial enrollment period, don't panic. You have another chance to enroll called the General Enrollment Period, or GEP. My industry loves acronyms. The GEP runs January 1st to March 31st every year. You can enroll in Part A during this time or Part B. If you're eligible, you can also join a Medicare Advantage or Part D plan that normally would be effective July 1st, because that's when your Part B would be effective. But new for 2023, the effective date of your Part B coverage can and will be the next month's effective date. So you don't have to wait all the way until July for your coverage to start. Now, late enrollment penalties may apply depending on your timing of signing up during the general enrollment period. Okay, and so we have one more pop quiz, I promise, last one. If you are turning 65 on December 15th, when does your initial enrollment period start? Great. So got a couple more people. Okay, good. So yes, most of you answered September, which is correct. Remember, it starts 3 months before your 65th birthday month. So if you have a birthday in December, that would be November, October, September. A lot of people think it starts 6 months before, but it is 3 months before is the initial enrollment period. And then also, if somebody had a December 1st birthday, their Medicare could be effective November 1st. It starts the month before. All right, great. So now that you have maybe a better understanding of when you'd want to or need to enroll in Medicare, but how do you do it? You are enrolled in Medicare Parts A and B automatically if you're receiving Social Security benefits or railroad retirement benefits at age 65. Also, people receiving Social Security disability will automatically be enrolled in Medicare effective the 25th month of disability benefits. If you're automatically enrolled, you'll receive your Medicare card in the mail. You don't need to do anything. Otherwise, you'll need to sign up yourself, which can be done online by calling Social Security or visiting a local Social Security branch, which I believe some of those are open now. So I've mentioned penalties a number of times during this presentation. Let's take a closer look at them. Part A, Part B, and Part D may charge late enrollment penalties. The penalty is added to your monthly premium if you have a penalty. Part B and D penalties are lifetime penalties. They are not a one-time penalty, one-time late fee. And penalties increase the longer you wait to sign up and are based on how long you go without coverage, similar to Medicare. So first, we're going to talk about the Part A penalty, which doesn't apply to too many people since most of us get Part A premium free. But for those who have to pay, the penalty is an additional 10% of the premium amount. You pay the penalty for twice the number of years you could have had Part A but didn't sign up. For example, if you go 2 years without paying for Part A, you'll have to pay 4 years of late enrollment penalty. And just as a reminder, you do not have to pay a penalty if you qualify for a special enrollment period. The Part B penalty is an additional 10% of the premium for each full 12-month period you could have been on Part B but didn't sign up, unless you qualify for a special enrollment period. You pay the penalty for as long as you have Part B. So for example, if you go 2 full years without Part B, you'll pay a 20% lifetime penalty, and that is billed by Medicare. And then again, I just want to remind you, no penalty if you qualify for a special enrollment period. Part D, late enrollment penalty. So remember, you have to have credible drug coverage as good as Part D to avoid this penalty if you enroll after your initial enrollment period. Also, if you qualify for extra help with your Part D costs, you do not have to pay a Part D penalty, and I'm going to discuss that on a further slide. The Part D penalty is an additional 1% of the current average plan premium for each month you're late. You pay the penalty for as long as you have Part D. So for example, if you waited 14 months after you were eligible for Medicare to join a drug plan and you didn't have credible coverage, you would pay a 14% late enrollment penalty in addition to your monthly plan premium. And this is collected by the private insurance company administering your drug plan. If you need it and qualify, you may be able to get help paying some healthcare costs. There are several programs shown here. It's worth asking about them. Even if you think you won't qualify, you may know somebody who could benefit from one of these. Medicare savings programs are applied through Medicaid, or here in Arizona, Arizona Access. These Medicare savings programs can help pay for Part A and B costs. This is also how people can qualify for Medicaid, provides healthcare coverage for people and families with limited incomes. Medicaid does vary by each state. It's not the same. For federal, it's state-based. And then also there's what's called PACE, Program of All-Inclusive Care for the Elderly. Some people qualify for this, and if they do, it's a Medicare Medicaid program that helps people meet their healthcare needs in the community instead of having to go to a nursing home or other care facility. The other type of program that helps pay for Medicare is called Extra Help or Low Income Subsidy. This is a Medicare program that helps people with limited income and resources pay their drug coverage costs, premiums, deductibles, coinsurance. And people who are eligible for the extra help will not have to pay a Part D penalty if they have one. And then I want to point out that if somebody's on the left column there, Medicare Savings Program, they should automatically be enrolled in the extra help on the right side. But others may have to apply for that. And that's applied through Social Security. This is just a quick reference to show you in 2022 for extra help on the drug plan side, your situation would have to fall within these limits, and resource asset limits do not include your primary place of living, your primary vehicle. There's a more complete list, but this is just a general idea to give you some figures. After applying and being approved for Part B, some people may receive a letter in the mail from Social Security about an income-related monthly adjustment amount. We call this an IRMA. Social Security determines if you owe an IRMA based on the income you reported on your IRS tax return 2 years prior to the calendar year or the year that you sign up. The income that counts is the adjusted gross income you reported plus other forms of tax-exempt income. This is referred to as the modified adjusted gross income. If you receive an IRMA, you will have to pay an additional premium amount for both your Part B as in boy and D as in drug. Social Security has 4 income brackets that we're going to look at next that determine your IRMA amount. Lastly, there are specific qualifying life events to appeal the IRMA charges. When you receive your IRMA letter in the mail, it should have directions on how to appeal if you're eligible to do so based on a qualifying life event. So I put together some of the income charts here to show you 2022 Part B IRMA, so you can get an idea of income brackets and then also costs for Part B. So you can see standard rate in 2022 is 170.10, but if you're a higher income earner or were 2 years ago, you may be charged a higher premium amount. And then here's 2023, and this will be included in the packet you get. Here is Part D, the drug plan portion. So your private insurance company will bill you your plan premium, but if you have an IRMA, you pay that to Medicare. It will be part of your Medicare premium bill. Here's 2023. More resources that are helpful in navigating the educational aspects of Medicare, Medicare.gov, 1-800-Medicare, your state health insurance assistance program. I also like to use My Medicare Matters, National Council on Aging, and Medicare Rights Center. Those are nonprofits. And that's the end of my presentation. Thank you so much. I'm gonna defer back to Christina for questions and answers.
I'm unmuting my phone. Hello there. Thank you again for, sorry, I can't turn off my, can you see me? No, you can hear me, I'm sure. Thank you again for attending our webinar today. There we go. Just like you all have a financial advisor, Cara is one of our trusted advisors. Please feel free to reach out to her for any specific plan questions. And we have about 9 minutes left here. So we're going to be respectful of your time, but we're going to go ahead and post some of the questions that were asked during the webinar. One of the questions, Cara, is I'm not enrolled in Medicare, but I'm in a Medicare Advantage plan through my state retirement system. What's the difference and what's the best way to go?
Good question. So retiree Medicare Advantage plans are different from the ones that individuals would purchase because it's a specific plan offered to you through the employer. As far as what's the difference, what's the best way to go, that would be a personal comparison for you. So I'd recommend if you have questions about that to reach out separately. That wouldn't be a one-size-fits-all situation if the retiree plan is better or not as many benefits as the individual plans.
Thank you for that. Another question is, what if I'm still working and have coverage through my employer? Should I still enroll?
Another good question. So this does depend on a couple of factors, your employer size and how they handle once you're 65. Some employers will require you to enroll in Medicare. Others may not. So that's something to ask your HR person or your employer. And if you are able to delay your Medicare, you'll actually have the option to do that or not. But otherwise, yes, if you're required to enroll, you should enroll to avoid the penalties.
Okay, a few more here. Do I need to re-sign up every year or will I be automatically re-enrolled each year?
Good question. So Part A and Part B will re-up every year. Medicare, Social Security will set the Part B premium for the calendar year. If you're on a Medicare supplement plan, Medicare Advantage, or drug plan, those will auto-renew unless there is a change in coverage that they are discontinuing the plan. So a lot of the times those plans will be auto-mapped for you, but that's the only situation I can think of where you wouldn't be auto-renewed necessarily.
Another question, I pay $140 for Part A and B, and there is no additional fee for, he wants to know, is there an additional fee for C and D? Is there a reason I would not sign up for C and D if there is no additional fee?
So again, that's a personal preference. The Medicare Advantage plans, they do vary based on premium. So if your question is, if you have original Medicare, would there be a benefit to adding a Medicare Advantage plan if it's no extra cost to you versus just having bare bones original Medicare? Yes, because a Medicare only covers you approximately 80%. That 20% is you, with no cap, your risk out of pocket. So the Medicare Advantage plans do help cap that risk.
And one more, are drug formularies different for each Part B plan?
Yes, for the most part, each plan has a separate drug formulary, so different drugs that they cover. Most of the formularies will cover some version class of the drug, but is it the specific one that you take? That's what you'll need to look at if you're shopping Part D.
Two more questions. What if I have a small employer insurance and my spouse is covered through me, but I am not eligible for Medicare? What do I do? What do I have to do to keep my dependents covered?
Another excellent question. So depending on the size of your employer, again, you may have to enroll in Part A and B, or you can delay it. If you want to keep your spouse and dependents covered under your employer plan, you don't want them to go on COBRA or through the exchanges. If your employer allows it, you can keep the plan with your dependents. But you know, the factor of will you have to enroll in A and B, again, depends on the employer size mainly. And your employer coverage, whether it's primary or secondary. And I'm going to have a handout in the folder you receive about that too, who's the primary payer.
And lastly, do I have to wait for my employer's open enrollment period to sign up for Medicare if I miss my initial sign up?
My understanding is that you can sign up for Medicare anytime once you're eligible. So you should not have to wait for your employer's open enrollment period. You should have a qualifying life event to switch to Medicare at any time once you're eligible.
All right. Well, those are all the questions that we have. There's nothing else coming through. So again, we appreciate everyone's time. Thank you for joining us. And on the last slide that you see, if you have any follow-up questions, even something specific to a plan, feel free to reach out to Cara directly. If you have any other questions, feel free to reach out to your financial advisor. Thank you again, and I hope this was helpful for everyone. Have a good rest of the week.
Thank you so much, everybody.